We'll be talking about ADHD. If you don't know what ADHD, it is one of the most common neurodevelopmental disorders of childhood. It is usually first diagnosed in childhood and often lasts until adulthood. Children with ADHD may have trouble paying attention, controlling impulsive behaviors, may act without thinking about the result will be or be overly active. Some signs and symptoms. It is normal for a child to have trouble focusing and behaving at one time or another. However, children with ADHD do not grow out of these behaviors. The symptoms continue, can be severe, and can cause difficulties at schools, at home, and with friends. A child with ADHD might daydream a lot, forget or lose things a lot, squirm or fidget, talk too much, make careless mistakes or unnecessary risks, had a hard time resisting temptations, have trouble taking turns, have difficulties getting along with others. There is 3 different types of ADHD. Presents itself depending on which type of symptoms are stronger in the individual. There's the first one is predominantly an attentive presentation. It is hard for the one to organize or finish a task, to pay attention to close detail, or to follow instructions or conversations. The person is easily distracted or forgets details on a daily routine. Second one is a predominantly hyperactive, impulsive presentation. The person fidgets and talks a lot. It's hard to sit still for a long part of time. Smaller children may run, jump, or climb consistently. The individual feels restless and has trouble with impulsivity. Someone who is impulsive may interrupt others a lot, grab things from people, or speak at inappropriate times. It is hard for people to wait their turn or listen to instructions. A person with impulsiveness may have more accidents and injuries than others. Then the last one is combined presentation. Symptoms of the above 2 types are equally present in the person. Because symptoms can change over time, the presentation may change over time as well. Causes of ADHD. Scientists are studying cases and risk factors in effect to find better ways to manage and reduce the chance of a person having ADHD. The causes and risk factors for ADHD are unknown, but currently research shows that genetics play an important role. Recent studies link genetic factors with ADHD. In addition to genetics, scientists are studying other possible causes and risk factors, including brain injury, exposure to environmental risks during pregnancy or at a young age, alcohol and tobacco use during pregnancy, premature delivery, low birth weight. Research does not support the popularly held views that ADHD is caused by eating too much sugar, watching too much television, parenting, or social and environmental factors such as poverty or family chaos. Of course, many things, including these, might make symptoms worse, especially in certain people, but the evidence is not strong enough to conclude that they are the main cause of ADHD. Diagnosis. Deciding if a child has ADHD is a process with several steps. There is no single test to diagnose ADHD, and many other problems like anxiety, depression, sleep problems, and certain types of learning disabilities can have similar symptoms. One step of the process involves having a medical exam, including hearing, vision tests, to rule out other problems with symptoms like ADHD. Diagnosing ADHD usually includes a checklist for rating ADHD symptoms and taking a history of the child from parents, teachers, and sometimes the child. Treatments. In most cases, ADHD is best treated with a combination of behavior therapy and medication. For preschool age children 4 to 5 years old with ADHD, behavior therapy, particularly training for parents, is recommended at the first line of treatment before medication is tried. What works best can depend on the child and family. Good treatment plans will include close monitoring, follow-ups, and making changes if needed along the way. Some managing symptoms, staying healthy. Being healthy is important for all children and can be especially important for children with ADHD. In addition to behavior therapy and medication, having a healthy lifestyle can make it easier for your child to deal with ADHD symptoms. Here are some healthy behaviors that may help. Developing healthy eating habits such as eating plenty of fruits, vegetables, whole grains, and choosing lean protein sources. Participating in daily activity based on age, whatever you like to do. Limiting the amount of daily screen time for TV, computer, phone, and other electronics. So let's let them explore. I was always outside when I was little, but getting the recommended amount of sleep each night based on age, yeah, I struggle with that. I don't sleep very good. I get probably under 5. No, it's not good. I can go to bed at get the 8 hours, go to sleep before the 8 hours or whatever, and I still wake up at least 7-8 times. My bad, dogs. Sorry. Alright guys, I hope you guys enjoyed that. That was ADHD. I hope this has helped you in some way, or you know someone with ADHD. We probably all have ADHD, to be honest with you, but if it has, make sure you give it a thumbs up, subscribe, share with friends. I love you guys. I will see you in the next video.